Hello everyone, myself Dr. Amit Jain, MBBS and MD in Biochemistry. I'm faculty at DAMS and we'll be discussing the June 2022 FMGE exam questions. Right, so they were around 7 to 10 questions in the biochemistry section. Okay, so there may be some options which may differ, as per your knowledge, that you can update me, right? So these are purely based on the recall of the students whom with I interacted. Okay, so let's start with the question number 1. So given picture depicts the deficiency of. So this question is very common question, has been asked several times in various exams. Okay, so this picture is representing the Castle's necklace. Okay, Castle's necklace, which is caused by the deficiency of the niacin. Right, so the answer for the question number 1 is niacin. So guys, this presents with a sunburn like the skin, and so that is caused by the niacin deficiency. Okay, so in the question number 1, it is niacin deficiency. So niacin deficiency presents with, the 3 D's, starting with the first D is diarrhea. So what is the sequence? Diarrhea, then dermatitis. Always remember that pellagra begins in stomach. So diarrhea, dermatitis and dementia. Right, dementia is like very late complication, so diarrhea and dermatitis, right? So in this case the niacin levels active form, which is NAD, is deficient. Okay, as niacin is very important vitamin for the oxidation reduction reaction. Okay, so we can say the metabolic reaction, especially the catabolism, needs the oxidation, and anabolism needs the reduction. So it is very important vitamin for oxidation reduction reaction. Niacin deficiency can be seen in lots of conditions, right, where the niacin is not made from, for example, when it is not made from the tryptophan. Guys, when we consume 60 milligrams of the tryptophan, so the only amino acid which can generate niacin, so we get niacin, that is 1 milligram. Okay, so in case of disorders where the tryptophan is decreasing, like for example in a condition that's called as Hartnupp's disease. Okay, Hartnupp's disease is caused by due to the deficiency of the neutral amino acid transporters in the kidney and intestine. So decreased absorption, increase in the excretion, both happens. So Hartnupp's disease, and it may be a case of the carcinoid tumor. Okay, carcinoid tumor. Fine, where the tryptophan is excessively utilized for the production of serotonin, right? So Hartnupp's disease and the carcinoid tumor. Then there may be a case which is due to the low supply of tryptophan to the body, right? For example, a diet which is rich in corn, right, and sorghum. So corn and the sorghum, which is also called as a jawar in the Indian subcontinent. So corn or the sorghum, rich diet. Okay, guys, what is the problem with the corn? The problem with the corn is that corn has niacin, which is bound to some polysaccharides, and it is not available for absorption through the intestine. Okay, so corn has niacin but is unabsorbed. Second thing, corn has low tryptophan content, right? So two things. Sorghum, right? Sorghum or the jawar, that has high amount of the leucine, right, which is a branch chain amino acid, and leucine is found to inhibit the tryptophan metabolism, which generates some niacin. Okay, so at various steps, the diet which is rich in leucine, which is like sorghum. So I'm talking about sorghum. Sorghum is rich in leucine, and anyway, like if anyone is consuming high amounts of branch and amino acids like leucine, inhibits the tryptophan metabolism to generate the niacin, right? So these are the common causes of the the niacin deficiency, right? So the first question, it is based on the Niacin deficiency. Guys, see the second option, copper. What is the copper deficiency is called as? Copper deficiency is called as Menkes disease. Okay, MENKE. Menkes disease, which presents with the special types of appearance of the hairs, that's called as like pilite torti. Right. Selenium deficiency is called as Keshan's disease. Okay, Keshan's disease, and iron deficiency is microcytic anemias. Fine. So Keshans, Mankis, these names are important ones and you should know them. Right. So question number 1. Then let's move to the question number 2. Okay. A child presents with the complaints of the urine turning black on standing. So what is the enzyme defects? Okay. So child is presenting with urine turning black. So guys, this is a case of the L-captonuria or the O-chronosis. Right. This is a case of the L-captonuria. Okay, and L-captonuria is a metabolic disorder of tyrosine catabolism. Right, tyrosine catabolism, where the deficient enzyme is homogenesic acid oxidase. Okay, so we have the two important disorders in the tyrosine metabolism. Right, one is called as the L-captonuria, that is homogenesic acid oxidase. Okay, some students said that the question was not on enzyme but what is a metabolite present in the urine, so that will be homogenesic acid. Then if it was a question that what is a metabolite present, so that will be your homogenesic acid in the urine. So that turns the urine black when it is exposed to the oxygen. Right, so homogenesic acid gets polymerized to something that's called as L-capton bodies, and that is what gives it the color. Okay, right guys, so L-captonuria. So L-captonuria is a condition, right, that's a condition in which the urine turns the black. That's one of the important point, right, that's one of the important point. But apart from that, right, this patient may present with the degenerative arthritis. Okay, degenerative arthritis of the larger joints, right, like the hip and spine. So most of the patient presents with the back pain. Okay, so degenerative arthritis, and there is change in the a pigmentation of the skin. So skin becomes hyperpigmented because of the deposition of these homogenesic acid. The special site where this deposits and which is easily identifiable is sclera. Okay, so it may deposit on the sclera, on the tip of the nose and pinna of the ear. Right, so these are the common sites which are visible sites. Like definitely it is also depositing in the collagenous tissues, and for example the joints also it is depositing. The sclera, nose and the pinna. Okay, so that is the L-captonuria. And guys, L-captonuria, if you take the biopsy of the skin, right, where there is a hyperpigmentation, you will find on the histopatho slide, after everything has been done, you will, under the microscope, you will find some banana bodies. Okay, you will find some banana bodies, and guys, these are ochre colored. Okay, ochre colored banana bodies. So that gives the name ochronosis. Okay, ochronosis. So ochre color, the color of the, let's say which looks like the clay or the mud or the mustard, something like that. So that is called as ochre colored. Fine. So that's the term ochronosis is also used here. Clear? So that's the question. There is no treatment. You can give vitamin C. In the management, you can start with drugs like vitamin C. Not drugs exactly, but antioxidants like vitamin C as a therapy, right? Okay, so that's our question number 2. Fine. See guys, option number B is the answer. Option B, pyruvate dehydrogenase deficiencies presents with lactic acidosis. Phenylalanine hydroxylase. Okay, phenylalanine hydroxylase presents with the as you all know, phenylketonuria, and tyrosinase deficiency presents with the albinism, right, with the albinism. Okay, So question number 3, moving on to the question number 3, which of the following is a complex 4 inhibitor? So as we all know, the answer is cyanide. Okay, so guys, cyanide H2S. So if we take cyanide H2S, azide, 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 and number 4th, it is carbon monoxide, not the carbon dioxide. Okay, carbon monoxide. So these are the 4 important inhibitors which are most commonly asked in exams. See, I would suggest everyone that always remember the names of inhibitors, from the biochemistry subject. There are very few names, and the questions are almost always there in the exams, right? Like definitely question complex 4 is being commonly asked, fine, and based on cyanide or carbon monoxide. But others are like oligomycin. Yes, oligomycin is an inhibitor of FOF1 ATP synthase. Okay, FOF1 ATP synthase. And British anti-leucite, which is also called as the dimer caprol or the BAL. So guys, that's the inhibitor of complex number 3. If antimycin was in the option, that is also again the complex 3 inhibitor. And rotenone is a complex 1 inhibitor, right? So dimer caprol or BAL, which is also a drug of choice for the arsenic poisoning, so that is also inhibitor of complex 3. So remember all the complexes: complex 1 rotenone, complex 2 malonate and carboxyl, complex 3 antimycin and BAL, and all these are complex 4 inhibitors. ATP synthase, oligomycin, FO. See, O is the term derived from the oligomycin, FOF1 ATP synthase, right? And one more thing, that is the inhibitor of the ATP ADP translocase, something which transports the ATP out of mitochondria, right? That is called as the ATP ADP translocase. So this removes the ATP out to the cytoplasm where it will be utilized, and this is inhibited by the atractyloside. Okay, by the atractyloside. Fine. So that's your inhibitors. So remember most of the important inhibitors. Remember the inhibitors of glycolysis, Krebs cycle, right, and then electron transport chain, and some inhibitors like inhibitors of RNA polymerase 2, and some inhibitors which are inhibitors of translation or protein synthesis in human beings or eukaryotes. So these are the major inhibitors we should remember, and that will hardly be a one page to remember, and a very important topic in the MCQ. Okay, guys, vitamin deficiency causing tingling sensation, right? Now, whenever such questions are asked, so tingling sensation means, guys, neuropathies. So they are talking about basically neuropathies. Now, neuropathies are caused by various vitamin deficiencies, okay, which affects a nerve. Neuropathies, like sensory neuropathy, is a kind of tingling sensation. So if I have to answer one, like if somebody asks me, sir, which which vitamin deficiency causes tingling, I would say it's B12 for sure, right? I will go for that vitamin B12 deficiency. But we don't have that in the option, right? If that was there in the option, definitely it's the answer. But this time they made it little twisted, but it's not twisted, guys. See, if we take the options, all the options, then I would go for vitamin B12 as the best answer, but there is no B12. So apart from that, the folic acid, okay, folic acid also causes the tingling sensations, deficiency of folic acid, like pins and needles kind of, gloves and stocking kind of, that sensations. Okay, so B12, folic acid are the two important ones. Fine. Now see, we have seen that okay, folic acid. So if we look at guys, various vitamins, okay, so thiamine deficiency, like especially the dry type of beriberi, also presents with neuropathy, right? B6 deficiency presents with neuropathy, right, as we all know. B12 deficiency presents with neuropathy. And then there was once a MCQ that which vitamin deficiency causes dementia most commonly. So if someone asks you dementia also, for most common answer will be again vitamin B12, right? Okay. Then vitamin E deficiency also causes neuropathy, but that is not common, right? Because vitamin E deficiency is rare, so that's not common. Niacin, see, niacin deficiency causes dementia. So dementia is also a kind of involvement of nerves. So that is again a kind of neuropathy. Okay, so there's these vitamins like vitamin B1, B6, B12 and E and niacin. So they all causes neuropathy. But the one thing that we have to remember is B12 and folic acid as the best answers, right? If there is a tingling word is utilized. Okay, so B12 or folic acid. And if they ask you the neuropathies, right, or they just they say that there is a abnormal sensation in nerves, okay, then again I will go for B12 and folic acid, but actually I can mark also thiamine, or I can mark niacin also, right? I can mark vitamin E also, right? So these are all correct options, isn't it? Right? Now some students said there was a question on there was a question in which the patient was mentioned. I have not included that question here, but they mentioned that there was a question something like that, in which there was ataxia was mentioned, and they asked again the vitamin deficiency. So patient had ataxia, right? Guys, ataxia again is common in multiple vitamin disorders. So if I look at this, see, cerebellar ataxia. Right, as we all know, thiamine deficiency, especially in the case of Wernicke's encephalopathy, it presents with ophthalmoplegia, ataxia and the global confusion, right? So B1 deficiency also presents, then B12 deficiency also present with cerebral ataxia, and vitamin E definitely, that's a separate MCQ which has been asked on vitamin E, that is like presents with the cerebellar ataxia, though the vitamin deficiency is not very common, right? And again the niacin deficiency presents with cerebellar ataxia, right? Okay, so guys, they just mentioned that there was a question on the ataxia. Okay, so guys, see, the common vitamin deficiencies which are seen, if thiamine was the option, right, that can be the best answer if the ataxia was word used in the MCQ, because thiamine deficiency is very common, especially like in alcoholics, and they present with this ataxia or the uncoordinated movements. Clear? Fine. So if dementia is asked, go for B12. If tingling sensation is asked, best answer is B12 again, right? Ataxia, go for B1. If the question is simply mentioning and nothing much information has been provided, like no history is provided that patient was adult and alcoholic, etc. So go for the thiamine otherwise. Clear to all? Fine. So moving to our next question, question number 5. Okay, so a patient has swelling in the metacarpophalangeal joints, serum uric acid levels were raised and allopurinol was prescribed. So now some student said allopurinol word was used and some said the drug was prescribed. They didn't mention the name. So anyways, we know that it's a simple question because there is a swelling in the metacarpophalangeal joints. So it points out to the gout probably because uric acid levels are also high, right? So allopurinol inhibits which of the following enzyme? So guys, allopurinol inhibits the xanthin oxidase, right? As we all know already, xanthin oxidase. Okay, so when we start with the purine catabolism, we start with the deoxy ATPs, right? With the deoxy ATPs. So ultimately we keep on removing the phosphate, right? Then we get ADP, then we get AMP, then we get A for adenosine. From the adenosine we get inosine, right? This enzyme is called as adenosine deaminase, which is deficient in the severe combined immunodeficiency, right? So guys, this adenosine will accumulate in the severe combined immunodeficiency. Okay, in the B and T cells, they will be unable to proliferate because of the various causes, because this adenosine which accumulates is said to be the apoptotic agent, right, which may cause apoptosis. Okay, so why only B and T cells? Because they are unable to excrete it. Then we get inosine. Inosine is made of hypoxanthine. So guys, when we remove the ribose sugar, right, so when I remove the deoxyribose sugar, I'll be getting hypoxanthine. Okay, hypoxanthine will be produced, and this hypoxanthine is acted upon by xanthine oxidase, okay, which produces the xanthine, okay, and this xanthine is again acted upon by xanthine oxidase, which produces the uric acid. So uric acid is just a oxidized, multiple times oxidized purine ring. Fine. So this enzyme, as we all know, is the enzyme which uses oxygen and produces hydrogen oxide also in the same above step. So this is a dangerous enzyme which produces the oxidative stress also. So it is inhibited by allopurinol, right? Inhibited by the allopurinol. Right, a very important drug. See guys, most of the cases of hyperuricemia are because of under secretion, right, of the uric acid. Kidney is unable to excrete it properly. Remember this point. Most of the cases, 70% plus cases, are because of under secretion. Okay. And guys, what causes the primary hyperuricemia and secondary hyperuricemia? See, primary hyperuricemia is caused by the deficiency of one of the enzyme we can see here, HGPRTase, and that causes the primary hyperuricemia. There may be a deficiency, overactivity of the enzyme, that's called as PRPP, okay, PRPP synthetase. Right, PRPP synthetase. So these two enzymes you can remember which causes the primary hyperuricemia. As we all know, HGPRT is deficient in the Lesch-Nyhan syndrome, right? Lesch-Nyhan syndrome, okay, which presents with hyperuricemia, mental retardation, and self-mutilation. Okay, self-mutilation. So that is enzyme. This enzyme I told you. This enzyme we have covered. Xanthine oxidase. Guys, xanthine oxidase, if it is deficient, okay, suppose now we are talking about hyperuricemia, but this deficiency of xanthine oxidase causes hypouricemia. That is again a MCQ. Hypouricemia will be caused. So remember that point. Fine. And there's one more point. Deficiency of xanthine oxidase also presents with the xanthinuria. Okay. Xanthinuria, again a MCQ, okay, which may be asked in your exams again, right? So low uric acid, less than 2 mg per dl, low uric acid. Hyperuricemia, I told you the causes may be various, but primary is caused by the deficiency of PRPP synthetase, okay, which is the first enzyme during purine synthesis, and HGPRTase, which is enzyme deficient in. Now guys, thymidylate synthase, if we have to remember, thymidylate synthase is inhibited by the anti-cancer 5-fluorouracil, right, which doesn't allow the conversion of uracil to the thymidine or UMP to the TMP, basically. So because it is U analog, so it is converting U to T conversion. So DNA synthesis, so anti-cancer. So guys, question number 6. Moving to the next question. So in the fasting state, glucagon maintains the blood glucose by activation of, so I didn't got the option number D. Okay, so guys, always remember that in the fasting state we have just two mechanisms to maintain blood sugar. Okay, so if somebody is fasting, right, if anyone is fasting, so in the fasting state we have to maintain the blood sugar. How much? 60 to 100 mg per dl. Why? Because our brain is always in need of, our RBCs are always in need of the glucose. So if it is like, if someone is fasting for the first 12 hours, okay, first 12 hours, then liver, only the liver hepatic glycogenolysis is required. Guys, muscles also have the glycogen, but that is not delivered to the blood. So that's why I have written liver glycogen for first 12 hours. So this is the majors I am writing, this is the major source. Okay, so that's the major source. If somebody is fasting for the next 13 to almost 17 hours, so guys, as in the option, gluconeogenesis and glycogenolysis are option, so gluconeogenesis and glycogenolysis, liver glycogenolysis, 50-50, they will be contributing 50-50. What is gluconeogenesis? Synthesis of glucose from sugar sources, non-carbohydrate sources, like maybe from amino acids, like alanine is the most important source, lactate is the second most important source, right? So 13 to 17 hours, if nobody is consuming food, then this 2 will be the, and guys, more than 18 hours, right? If it is more than 18 hours, then you go for the answer as gluconeogenesis as a major source. And you can also write one line, that is, if it is more than 18 hours, right, then liver glycogen, a very important question that can be in your exams also, repeated again. So liver glycogen is finished. Always remember this, liver glycogen is finished by the 18 hours. Okay, so if somebody asks you, like, if a person is fasting for more than 24 hours, 18 hours, what is the major source of blood glucose? You will say gluconeogenesis, and the cells have already started using the ketones. But ketone is still not a major source of the glucose, energy to the brain. If the brain is asked, then if the brain is able to utilize the glucose by minimum 48 to 72 hours of fasting, that is 2 to 3 days. Still the glucose is major source. So see, in our MCQ they have not mentioned the time and they have not mentioned the organ. So they just mentioned, suppose if this was the actual question, if in the fasting state glucagon, what it does. So guys, as we fast, we increase two hormones, right? There is increase in glucagon and cortisol, and both increase the blood sugar. Okay, so glucagon activates both of them, right? Glycogenolysis and gluconeogenesis, both are activated by the glucagon. Glycogen phosphorylase is activated by the rate limiting enzyme of glycogen is glycogen phosphorylase, which is activated by glucagon, and gluconeogenesis enzymes like this pyruvate carboxylase and PAPCK. Okay, so they are under the control of glucagon, right? Okay, cortisol also do the same. If cortisol increase the blood sugar, then I will mark the answer gluconeogenesis only, like A. So if the option was only cortisol, see, cortisol directly doesn't increase the glycogen degradation. Okay, not directly. Epinephrines and norepinephrine's in the stressful state, they can cause glycogen degradation, but not the. So again, I'm telling you, if only cortisol was mentioned, this which is a glucocorticoid, go for gluconeogenesis as the best answer. And if glucagon, then go for both. I told you, because they have not mentioned the time. If they have mentioned that in the fasting first 12 hours, if they mention like this, then I would go with the glycogen as the best answer. Okay, fine. Question number 7. For the treatment of lactic acidosis caused by the deficient pyruvate dehydrogenase enzyme. So guys, when the pyruvate dehydrogenase enzyme is deficient, the patient presents with lactic acidosis. So how will you treat that? So the best way is, don't give anything which makes pyruvate. And as we all know, pyruvate is made by the glucose or the carbs. Fine. So avoid carbs and give something which makes the ketones. So how the ketones are made? Ketones are made by the ketogenic diet. Okay. So in this MCQ, first of all, you should know that PDH, PDH is a very important enzyme, pyruvate dehydrogenase. See, normally we convert glucose to pyruvate by the glycolysis, and pyruvate is converted into acetyl coenzyme A by the PDH. Okay, and then acetyl CoA goes to the Krebs cycle, right, and generates some ATPs via the electron transport chain. Okay, so whatever is generated in the TCA like NADH, it goes to the electron transport chain. Now, if there is a PDH deficiency, the pyruvate doesn't converts to acetyl CoA. So the pyruvate converts to lactate. So what are the fates of pyruvate? Pyruvate can make acetyl CoA, pyruvate can make lactate also. Right? Pyruvate can make oxaloacetate also by pyruvate carboxylase enzyme in the like such a gluconeogenesis and Krebs cycle. Okay, so guys, lactate is made, and that causes a lactic acidosis. Some student mentioned that there was some pyruvate to lactate ratio, lactate to pyruvate ratio was given. So that's the same thing, doesn't matter whatever the ratio is. Okay, I mean, like, there is lactic acidosis if it is mentioned. Okay, and the lactate levels are said to be higher in the ratio also. That's a case of PDH deficiency. Most common cause. What is the most common cause of congenital lactic acidosis? This is the answer, PDH deficiency. Understood guys? So how will I treat? Don't give glucose. So my option should contain low carbs. So my first two option contains the low carbs. But should I give high protein or high fat? See guys, both can be correct. High protein also correct, high fat also correct. You know why? Why the high protein and see, I want to give a diet which contains high fat, okay, plus the low carbs. Why the low carbs? You got the point, because carbs will make the lactate, so I don't want to give the carbs. Now high fat, guys, high fat convert into ketones, and the ketones is the energy to cells, right? Okay, for example, brain is an organ which cannot use anything else except the two things, right? One is called as glucose, other is called as ketones. But my muscles, my other cells, they can use multiple sources of energy, amino acids, fats, okay, then glucose, okay, etc. So they can use anything which is available. They are like omnivorous. Like for example, my muscles are omnivorous. They can take anything as a diet, fatty acid, amino acids, or the glucose. But brain can use only glucose in the fat state, but in the fasting it can use ketones after the 3 days of fasting, 2 to 3 days of fasting. Clear? So that's the reason we give more fats. So high fat, low carbs, and I just want to give moderate amount of the proteins. Okay, moderate amount of proteins. If I take the percentage, otherwise this should be around 60% or more. Carb should be less than 10%, and protein should be around 30% or less than that. Okay, so it should be like less than, but around 30% of, let's say 20 to 30% of proteins. So guys, such diets, why are you giving more proteins? Because more proteins means more proteins can be used for making of the glucose. To maintain the blood sugar, I want to do gluconeogenesis now, so that can be done using the proteins. Okay, to maintain a small amount of blood sugar. So guys, this is called as a ketogenic diet. Okay, ketogenic diet. Fine. And somebody said that there was a question on some other diet like Atkins diet. One of the student asked me, sir, there was some question on Atkins diet. Okay, so what is Atkins diet? This was once asked in some other exams also previously. It is similar to the ketogenic diet. Okay, that is similar, almost similar. But it is the amount of carbohydrates, they changes with the duration of diet. Okay. Right, so I'm not talking about Atkins diet right now. I don't know if there's a question or not. There are lots of diets available, but ketogenic diet is the one which is used in the treatment of, you can say PDH deficiency, and guys, you can also say the deficiency of GLUT1. Okay, GLUT1 is present in the blood-brain barrier. So in the GLUT1 deficiency, you can give the same diet, that is high fat, low carbs. Protein you can adjust, right? Fine guys, if any other questions are available, okay, you can send me these questions on the Telegram group with my this name, that is DAMS Biochemistry. Okay, if you have any other question, you can ask me there. That is on the Telegram, DAMS Biochemistry, right? So thank you so much guys. If anything which is different from your recall, let me know about it. Okay, any other question if you want to ask me, you are most welcome. So thank you so much guys.